Imagine waking up to a world where there are no nurses. Hospitals would be overwhelmed, routine checkups would be delayed, and public health emergencies would be catastrophic. Nurses just don't provide bedside care. They are the backbones of our healthcare system, ensuring that communities remain healthy, especially in times of crisis. Today, I am going to inform you about the critical roles that nurses play in public health. Nurses do so much more than treat individual patients. They help rebuild public health systems after crisis, shape healthcare policies, respond to emergencies, and address healthcare disparities. Their work has a lasting impact on not just individuals, but the entire community. Nurses are essential to public health, serving as leaders and caregivers in rebuilding health systems, shaping policies, responding to emergencies, and reducing health disparities. Without them, our healthcare system would not function effectively. Now I'm about to review my main points. My first main point is nurses play a key role in rebuilding public health after major crises. My second main point is nurses help shape the future of healthcare policies. My third main point, nurses are essential in public health emergencies. And my fourth main point is nurses work to reduce health disparities in undeserved communities. My first main point is how nurses in rebuilding in public health systems. When rebuilding public health systems, they are weakened by crises, such as the COVID-19 pandemic or natural disasters. Nurses play a critical role in restoring and strengthening healthcare infrastructure. According to the Pittman and Park 2021, nurses have been instrumental in rebuilding public health systems by engaging with underserved communities, providing continued care, and ensuring public health education reaches those who need it the most. Their effort includes mental health support, vaccine distribution, and advocating for healthcare accessibility. Without nurses leading the charge in rebuilding after a crisis, many communities will struggle to recover. Now I will show you how nurses help the community by doing a vaccination drive. Now that we've explored how nurses rebuild health systems, let's look at their impact on shaping policies that determine the future of healthcare. My second main point is to show how nurses shape the future of public health. Nurses do not just follow healthcare policies, they help create them. Their frontline experience makes them key advocates for policies that improve healthcare accessibility and patient safety. The Robert Wood Johnson Foundation 2012 highlights that nurses are often the driving force behind healthcare reforms, working with policymakers to ensure laws and regulations reflect the needs of patients and healthcare workers. From expanding healthcare access to ensuring better working conditions in hospitals, nurses are deeply involved in advocating for change. Many nurses serve in leadership positions, including decisions at local, state, and national levels. While nurses help shape policies, they also serve as first responders in public health emergencies, stepping when crises strike. My third main point is nurses in public health emergencies. When a disaster strikes, whether it's a pandemic, a natural disaster, or a disease outbreak, nurses are the first line of defense. According to Nurse Journal in 2025, nurses in public health emergencies are responsible for managing patient care, coordinating the medical resources, and educating the public of disease prevention. During the COVID-19 pandemic, nurses worked around the clock in ICUs, testing sites, and vaccination centers, ensuring that the care was provided despite overwhelming demand. Their ability to stay calm under pressure, organize care efforts, and provide emotional support makes them indispensable during the times of crisis. My second visual aid is going to show how the nurses were helping after the Hurricane Helene with the Red Cross. While nurses are crucial in emergencies, they also work daily to address ongoing public health challenges, including health disparities. My main fourth point would be how nurses address health disparities. Healthcare is not just for everyone, and nurses play a vital role in reducing health disparities by advocating for and providing to underserved populations. Nurses focus on improving access to healthcare in rural and low-income communities where medical services are often limited. According to Nurse Education 2024, many nurses of development community health programs of the preventative care, wellness education, disease manager help reduce long-term health diseases. Another transition that I'm going to go to is now that we've discussed the many roles placed in public health, let's recap why their contributions are essential to society. Throughout this speech, we've seen how nurses impact public health in multiple ways. They help rebuild systems after major crises. They help shape healthcare policies that improve patient care. They serve on the front lines during pandemic and public health emergencies, and they also work to address health disparities and ensure equal access to care. Nurses are not just caregivers. They are leaders, educators, and advocates who play an essential role in shaping the public health and keeping communities safe and healthy. Nurses do not just treat illnesses, they change lives and build healthier communities. The next time you see a nurse, remember that they are not just only caring for individual patients, but also working tirelessly to improve healthcare for all of us, supporting and empowering nurses, investing in a healthier, strong future for everyone. Thank you for listening.